Stem cell therapy is a way to regenerate and improve health of patients with a variety of chronic diseases, injuries, and other conditions. But how do you know if this type of therapy is right for you, and moreover, if you're a candidate for a stem cell treatment? Today we'll speak to a doctor at Swiss Medica who will explain how the initial consultation works and how the decision is made about whether stem cell therapy is suitable for you. Doctor, what type of health conditions do patients come to Swiss Medica with? And how can stem cells help with these conditions?
In Swiss Medica, we treat a variety of different conditions.
Starting from some cosmetological issues such as scars on skin aging.
The pediatric cases such as autism or cerebral palsy.
Neurological disorders, MS, ALS, Parkinson's.
Cardiovascular diseases.
And degenerative diseases of joints and nervous system.
COPD, asthma, interstitial lung disease.
Some orthopedic problems, autoimmune disorders, and much more.
Basically, the stem cells can promote tissue regeneration, new vascularization, and overall inflammation quelling.
They improve the functioning of different tissues and improve the overall condition of the health.
Doctor, can you explain how the consultation begins? How does the patient first get in touch with you?
It all starts when the patient submits a request for a free online consultation with a doctor.
Patients, first of all, get in touch with our medical advisors so they can determine what the request is and what the trouble in general is.
Usually patients come to us via website.
Secondly, our social media. Only after that, they will fill out the form of our questionnaire, and doctors will
ask to provide any medical documentation that they have, imaging files, blood works, other lab tests. So after that, we can assess the case.
Then we get in touch with the patient. It can be a phone call or a video call, and we discuss all the patient problems, all their unique needs.
During the consultation itself, we might ask for additional reports if the situation is unclear for us.
And also to clarify presence of some contraindications, for example, cancer in case history, for example, clotting diseases and so on.
And of course, all the possible outcomes and benefits from the treatment.
What specific questions do you ask the patient in order to understand whether stem cell therapy might be appropriate for them?
Well, that varies. It really depends on the condition itself. Obviously, you're not asking the same questions for different people, but
the most important part is getting the whole anamnesis.
So basically, how long you've been suffering from it?
The stage of the disease, results of laboratory tests, and other investigations. Of course, our main concern, not only effectiveness of treatment, but also its safety.
We ask lots of questions about how the disease started, what was the initial symptoms, what are the coexisting diseases the patient may have, of course, what kind of treatments they already tried before going to the stem cell treatment.
We are not just guided by the diagnosis itself. We need to understand the functional status of the patient, because some people are more severe, some people are mild, and you cannot use the same treatment plan, the same program for everyone. So we need to tailor that. Hence, we need to know the status of the patient. So.
And sometimes we request some specific examinations, like laboratory tests or results of MRI, CT scans, and others.
So we need to understand prognostically what will be preliminary effect in these patients.
Of course, mesenchymal stem cell therapy, it is a very effective thing, but in some conditions we are not capable to improve the condition of the patient, so we should determine this thing.
What happens if you're unsure whether stem cell therapy is the right treatment for a patient?
If we are not sure if the patient is a candidate for the stem cell treatment, we gather a team of our experts.
We will discuss this case with our cardiologists, with our anesthesiologists and other doctors.
The consilium decides whether it's a good option to have a stem cell therapy, and also we discuss the specific methods of administration and specific cells that will be used in the patient's case.
And to determine the best way to not risk with the health of the patient. After that, if a patient is suitable for treatment, we will proceed with individualized treatment plan without any additional risks for the patient.
In situations when we see that the stem cell treatment is not indicated, we can suggest also 5 bottles of exosomes to take home to try this option.
If collectively we decide that, okay, this is not something that we're happy working with because of the severity of the condition, because of the risk factors, etc., then unfortunately we will have to reject such patient.
And if the patient is a candidate for a stem cell treatment, what happens next?
Once we determine that the treatment is appropriate, we conduct a specific treatment plan.
Tailored for his individual needs. If not, maybe we will ask some additional reports or some lab tests for us to be more precise in our tailoring.
The medical advisor organizes all the process, including the arrival of the patient.
With all the steps of the treatment, with all the specific methods that we'll be using, all additional treatments, examinations, stem cells, and of course the after-treatment care.
So, is the approach to each patient always unique? How do you choose whether to use patient's own cells or donor cells? And how do you choose the method of administration that works best for each patient?
So, basically, yes, the approach itself is unique.
We should very carefully, very thoroughly adjust plan to personal goals and personal needs of every patient.
We consider not only the diagnosis, but some coexisting problems, the overall health condition.
Of course, we won't use the one similar treatment plan for different conditions, for different severities, for different diagnoses.
The stem cell treatment is not one size fits all.
Although there are some core treatment parts that we need to be more, let's say, methodical about, because if you want to have a stable outcome, you need some stable prerequisites, right? But as I told you before, all patients are different.
That's why we need to choose in each case what kind of administration we're using, what kind of stem cells we're using.
For example, in patients with autism spectrum disorders, we will use donor stem cells. In patients with neurodegeneration, we will use their own stem cells, and of course we will administer them in different ways.
For example, the patient with osteoarthritis may have asthma as a concomitant condition. In this case, we combine.
We can have different applications. First of all, it is intravenous drips, intravenous infusions, but in some cases it is more efficient to use stem cells locally. So it really depends on condition, severity and diagnosis.
It could be both the donor cells and the patient own cells, and we have more than 20 different methods of administration.
Have there been cases at Swiss Medica where patient came with multiple symptoms and diagnoses and you were able to help?
Yes, in fact, it's our casual case because most of our patients come with multiple diseases and multiple symptoms.
For example, joint diseases and diabetes mellitus, asthma and diabetes mellitus, asthma and osteoarthritis, for example, lots of such cases.
So we try to cover all the patient's needs.
And one more question. Maybe there were situations where other clinics couldn't diagnose the patient, but you managed to find a solution. Can you tell us about it?
It happened multiple times when the patient is coming to the clinic to treat a specific disease. But we doubt about the diagnosis. So we conduct our own examination. We do some tests. It could be laboratory tests, MRI, CT scans, and many others. And we find out that diagnosis is wrong. So the patient for all of these years got the wrong treatment from the wrong diagnosis. And usually it's a big step for patients to understand that they were treated in the wrong way.
Today, we had a chance to meet Swiss Medica's consulting doctors and to understand how the initial consultation works. You can discover more about stem cell therapy options for you and your loved ones through our free online consultation. To book a consultation, please leave a request at startstemcells.com. See you in the next videos on Swiss Medica channel. you.